Thank you, Ron. Well, expectant parents have so many questions when waiting for a baby. Our friends from Vanderburgh County Health Department's Pre to 3 program have some answers for them. Nurse Nancy Harness and health worker Tamika Goins are my guests today. Good to see you both.
Thank you for having us.
We're big fans of this program, as you know, and we've been sharing some of the stories, personal stories about what you're doing. So I'll start with you, Nancy. When should young people start preparing for baby?
Well, right away. So as soon as you find out that you're pregnant, you get that positive test result, that's a good time to start preparing for baby. At the health department, we offer free prenatal or free pregnancy testing. And during that visit, when it's positive, we help you connect with the doctor, tell you a little bit about our Pre to 3 program, kind of set you on the right path to have a healthy pregnancy right there from the start.
So come in and get that test, and then the protocol follows through right through there.
Just from there, yes.
That's a good way to go. And Tamika, let me ask you, especially for first-time parents, what are some of the worries and concerns they share with you?
Are they going to be good parents? What do I need? How will I know when I'm in labor? When will cravings start? There's just so many, especially for the first-time parents.
Well, I mean, it's a mystery to all of us the first time, isn't it?
Yes,
and when you're younger, it makes it even more of a challenge. So you're just kind of really sitting with them and walking them through the process, aren't you?
Yes, ma'am. When they have questions, we have the curriculum that we go through. But if they have questions, you know, they can always ask me, or some of them even text me, you know, with certain questions that maybe they forgot to ask during our visit, or things that just might come up throughout a day.
And they do.
Yes,
well, and now you visit in the home.
Yes, ma'am.
What's that process like?
It's interesting. You just go in and you become family after a couple of visits because they warm up to you and you feel comfortable being in their home. So it's just like going over a friend's house, except for I'm working, and it's a good feeling.
And what are you looking for when you're in there as the healthcare professional?
We're not particularly looking for anything. We just want to be there for the people that want us there, that would like for us to help them, to get on with this Pre to 3 as far as their pregnancy and any questions or concerns that they may have.
And I know there are lots. Well, Nancy, how do you help the Pre to 3 parents get ready, get on the right path, and stay on the right path?
Well, as I mentioned before, we help them maybe find a doctor if they already don't have one. We set them up with our client advocate. Maybe they need help with Medicare, insurance, resources for finding housing, maybe even finding a pediatrician, even though that might seem early before the baby's even there. That's a good way to start to be prepared. So just giving them the resources that they need so that when the baby does arrive, they're not overwhelmed with so many things that they need to do.
Well, and you follow up with them even after the baby comes. This is the Pre to 3.
To 3 years old.
Yes. So they're not alone once that baby's born. We come to the home, we visit, we've got the nurses on hand, a lactation counselor, and somebody to even help them set up their car seats.
If someone who's watching has a family member, or maybe they themselves feels like they might want to be a part of your program, how do they do that?
They can text family to number 99888 or go to the pre to3program.com website.
And see everything that's on there and what's available to them. Well, I know you're going to be back in the months to come to tell us more about your exciting program. Thank you both so much for what you do.
Thank you for having us.
Making us have healthier families in our neighborhood.
Thank you.
We'll be back with more Lifestyles right after this. Please stay.